Pro Group Management. Workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, Duy Nguyen joins us, an Assembly member from Las Vegas, here for the whole show on an all-new Nevada Newsmakers.
When in Carson City, Nevada Newsmakers records in the conference room of the Nevada Builders Alliance. Coverage of the 2025 legislative session is brought to you by Pro Group Management, workers' comp that works for you. NV Energy, proudly serving Nevada, providing electricity to 2.4 million electric customers. The Retail Association of Nevada, looking out for business. And by Story County, helping build Nevada's future.
The trucking industry is the most resilient link in the supply chain, moving 95% of our freight in the Silver State. And while essential, the road isn't always smooth. Supply chain disruptions, rising fuel costs, and unrealistic rules and laws that hamper our ability to serve our customers and country. Our prosperity and every sector of the economy, manufacturing, mining, medicine, and food from farm to table, is tied to trucks. There's nothing without trucking.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
Meet Nevada Health Link, Nevada's official health insurance marketplace. Your link to savings, selection, free assistance, and name brand health insurance, where 90% of enrollees lower the cost of their monthly premium. Everyone deserves access to quality health coverage, no matter your income or family size. Visit NevadaHealthLink.com. A few minutes could save you hundreds of dollars per month.
Nevada Health Link. Our plans are made for your plans.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, coming to you from Carson City, from the home of the Nevada Builders Alliance. We are delighted to welcome to the program for the first time Assemblymember Duy Nguyen of District 8 in Las Vegas. It is a pleasure to have you on the program, sir. Thank you.
Thank you for having me.
You are very welcome. Just to point out that you are the Vice Chair of Government Affairs. You are also the Vice Chair of Health and Human Services. You sit on Growth and Infrastructure and Revenue as well. So you're involved in a lot of important committees. You're also Vietnamese American. And so if you don't mind my asking, how many Vietnamese are there in Southern Nevada?
I think if we take an estimate, it would probably be about 20,000 Vietnamese.
That's a pretty large community.
Mm-hmm.
Very active.
Yeah.
And you were not born in the United States.
No.
When you came over, what were the circumstances with your family?
So my father was one of the boat people back in the early 80s. So he left Vietnam in the middle of the night on a fishing boat that probably fit about half the size of it's supposed to fit. So we're about maybe 200 people on a very 80 people fishing boat trying to escape the oppression at that time. And most of those folks don't make it during that journey. So it was a very, very unpredictable journey for people at that time. And so he left, and the boat capsized probably a mile out to shore, Malaysian shores, and he swam to shore and was in the refugee camp for about, a year in the Philippines before he was sponsored to the United States. So I didn't meet him growing up until I immigrated here. Back then, there was no such thing as FaceTime, so didn't know what he looks like other than pictures. And so we reunited in 1990 when I immigrated to the United States.
Now, did he initially come to the Gulf Coast, because that's where a lot of Vietnamese refugees resettled, or did he come initially to Las Vegas?
So we actually were settled in San Diego, actually Oceanside to be specific. So that's where we lived before I moved to Las Vegas. So when he got sponsored, he came right to San Diego.
That's an amazing story.
Yeah.
Well, thank you for sharing that
Of
with
course.
us. I want to talk about some of your bills, and I wanted to start with the kin care bill. Tell me what that bill's about.
Well, it's about basic workers right here for Nevada families. That bill is truly make sure that we standardize the sick leave in terms of being able to take advantage of that policy to take care of your family members. I think those are very basic. I have young children, I have elderly parents, and if I use that sick leave to take care of my loved ones, that bill would be able to standardize that across Nevada. So it doesn't matter who you work for, where you work for, if your employer has a sick leave policy, that you can use that for your family members. And that's very important for us to have these days.
Okay, are you getting much pushback on that?
No, actually, I think it's a very collaborative process. I think employers, small business, big business, alike across the state, recognize that importance, that it is very productive for their employee to be able to take care of their loved ones, and so that they can focus on work rather than, be able to stress out or rather be very, very stressful. I guess that's the worst I can say. That would be a difficult hardship for everyone when you're at work and you're thinking of your loved one that are sick and you can't do anything for them. So those are, as parents and as someone who have elderly parents, those are things that is important to me. And I think that would boost my productivity if I know that I can take care of my loved one and that my company cares about me and my organization cares about me and my well-being as well as my family well-being, so that I can continue to be productive at work.
So does this point to something that I try to talk about on this program, which is that there's a lot more bipartisanship with the legislature than people might think of, because they see the big bills that people argue about, but bills like this tend to get support on both sides of the aisle.
Absolutely. I think the basic is definitely what we all strive for. We all strive for making sure that the basics are covered before we go and do fancy things. And right now, if we look at the state of our country, and every headline that you look at, you just have a little bit of heart palpitation just because of strange things happening across the globe. Right here in Nevada, we are working together. We are collaborative. We do things that moving our state forward. And I love that part about my job, is that we get to truly put our heads together and solve problems and not create new ones.
Another one of your bills, and this is a pretty important one to my mind, is your financial literacy bill. Give me the specifics on that.
Well, as you stated earlier, for my background, I'm an immigrant. And so coming into the United States at a young age, I was taught a few things. I was taught to put your heads down and just get to work and assimilate, just, mix in, and then go and go study, be a doctor or lawyer or engineer. We think about those kind of professions because of that financial security that comes with it. And even though I'm apparently a bad Asian because I didn't choose any of those three things, but I also took my own path and learned for myself what that would be like in terms of getting into a profession that you love. And then you have to go through school and you're taking out student loans, and no one read those little fine print that you have to pay them back. And for me, now this is dating myself, but 25 years later after finishing my undergrad, I'm still paying for my student loan. And that could set a lot of people back from obtaining that American dream of owning a home, being able to, manage their household and be able to thrive. So financial literacy for me is about truly understanding the tools that is set up in our society to be able to understand what that tools can do for you, or also what that tools can also harm you if you don't make the right decisions. College campus, for example, when you walk into a college campus as your first day in orientation, there are tables of literatures and what do we call it, freebies, where they give out swag. If you apply for this credit card, you get a free T-shirt. Well, a young student may not have that background and understand if you get that credit card, you max it out, you only spend a minimum. There's a thing called compound interest that they're not aware of. And those things accumulate, and over time they will be over their heads and going to be in kind of financial cul-de-sac, because then they're not able to have good credit. That is the basis for getting a good interest rate on a car or home purchase, or even be able to manage their daily lives. So those are pretty common sense and basic things that we're not taught in school. We're taught everything from, statistics to physics to algebra. Most of us don't even use that right now in our everyday lives. But financial literacy, every single day, whether you're 5-year-old or 85-year-old, you're making financial decisions that affect your daily lives. So why not provide that tool in school?
No, I couldn't agree with you more. And I think one of the best things that has happened in the last decade or so was when you get your credit card statement, it says, if you pay the minimum, this is how many decades it will take for you to pay off this bill. And your bill starts out at $20, and you're still paying for it decades later. So I couldn't agree with you more. Also, I wanted to ask you about another bill that you've got, which is your prior authorization bill that concerns medical and dental treatment. Explain where that's going.
Another topic that we also lose sleep at night about. Medical care is definitely a bit of a crossroad at this day. We have a bit of a recruitment and retention issue in Nevada in terms of healthcare.
Just a little.
Just a little. But on the very, very big component of that is the standard of care here in Nevada. And for an average person to go to a doctor and, God forbid you have an illness and you have to use your insurance and your doctor is prescribing a procedure or a certain medication, and then you have to wait. And that wait time could be up to 20 days currently per law. And so if you have a serious condition and you have to wait 20 days for that single authorization and then have to wait 20 days more, if there's another condition that kind of derives on top of that, you could
be
end
dead.
up, you can have, well, hopefully not dead, but you can up to be
40 days, that's a long time.
critically ill, right? To wait for a procedure to be approved. And so that wait time kind of add on to the problem of the standard of care that we have. And then this is just not Nevada, but across the country, we need to improve that wait time so that everyday people don't feel like the medical insurance is working against them.
Okay, so what kind of pushback are you getting from the insurance industry?
Interestingly enough, my conversation with the insurance industry has been very positive. One of the things that I love about this process is that I bring all the stakeholders to the table, and we've been having really awesome discussion about what does that look like in terms of how we can meet in the middle and be able to support both, the insurance company as well as the patient and the medical provider. There's so many hands in this particular conversation that we need to make sure that everyone's at the table. So, with all the meetings I've had for the last few months, everybody come together and agree that it should be shorter. So we're all going to match now the standard that the Center of Medicare and Medicaid Services, which is known as CMS, which is a federal statute. The federal program right now is that it's either 7 calendar days or 5 business days as it's in the law, and then 48 hours for urgent authorization. So if you have something that is more critically important and you need to get treated right away, that urgency that your doctor put in, now you have 48 hours to get that authorization.
Okay, so what happens if you're in the emergency room?
Well, emergency room will not need prior authorization. Because those are much more on a dire basis, prior authorization will not be needed. So these are for the urgent, outside of emergency room cases, as well as the routine. So now it goes from 20 days to 7 days. And that is going to be very, very helpful for all patients across the board. And this is just not for certain insurer. This is just for all insurer in Nevada, where if you are using your medical insurance, you would have the advantage of having this prioritization in a short time. And additionally, the bill also require now all insurer to provide their data annually to the Division of Insurance, so that the insurance commissioner can see and the public can see what is the denial rates of certain insurance. So, for example, if there's a simple math, 1,000 cases, and they deny, 200 cases, that means, 20% are being denied, and that is going to help the consumer to pick the right plan or to pick the right insurer. Because if you're gonna go with a company that does not support you, why are you, a member of that company? So we want to be able to promote transparency, so that the insurer can tell the world what they're doing.
So in my opinion, that's one of the reasons why one should have an insurance broker, so that they can lay out all the options for you, and you can. But you need somebody that you can trust. But I'm fortunate to have a terrific insurance broker, and he lays out all the plans for me, and then we can make a decision based upon the response times, etc. All right, let's take a break. We'll come back more with Assemblyman Duy Nguyen after this timeout.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
Carson Valley Inn, it's your place for the good times. Carson Valley Inn.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Assemblymember Duy Nguyen of District 8 in Las Vegas. The movie studios. Your thoughts on this? We've had a lot of legislators come in here and be somewhat skeptical, dubious, whatever word you want to use. But potentially it could be a huge amount of jobs and a huge benefit to the state. What are your thoughts?
I think I agree with all of the thoughts out there right now. I think we are in the crossroads of truly diversifying our economy, and there's so many options presenting to us, and this is one of them. And I think that is a great option to consider, because we already have the infrastructure here. We already have the film school. UNLV has the film school, so it's a great setup for the students to be able to know that there is a path for them to be right here in Nevada, not have to go anywhere else, so we can be able to retain the talents that we have here. We are the entertainment capital of the world, so it would be great to be able to have that background of being able to feed to the growing entertainment sector, that there are so many wonderful things that Las Vegas and Nevada has to offer. I mean,
Okay, so here's a question. Where do they live? If you're looking at 18,000 permanent workers, where do they live?
right? We are, very, very densely populated in Las Vegas, but we still have amazing populations all over of our 17 counties in Nevada. So it's not a hard thing to do in terms of that. And I think we're growing after the pandemic. We're growing quite nicely, and we have so many folks finding Nevada as a great place to live and work and raise their families. And I think we have the ability to do that here. I think we need to look at it carefully from a growth, but also we want to be able to create opportunities. And we're not just a, one trick pony anymore. We have many things that we can offer for, our Nevadans to be able to stay here in Nevada and be able to choose what they want to do. And the film and entertainment industry is very diverse in terms of the career choices, whether you're in front of the camera or behind the camera. You have so many options, and this is what it will be helpful for us to look at, because why not, right? We should look at all the possibilities that want to come to Nevada and do business here. We should be the number one, destination to do business in the country. And film credit could be part of that.
All right, let's take another break and we'll be right back.
What is that?
That's the governor's funding bill for education.
It looks pretty flat. Wasn't there a plan to increase funding for our schools?
Yeah, but the governor's ignoring it.
We have to pass the plan.
For 50 years, Nevada Heating has been keeping people comfortable in their homes. At Nevada Heating, call the Do It Right guys and get the air conditioning back on today. That's the Nevada Heating way. Why sweat for days on end when Nevada Heating can get your air conditioning fixed today? Call us today and we'll fix it today at 323-5585 or schedule us on our website at nevadaheating.com.
Welcome to Story County, where history meets innovation, and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. But it's more than just growth. Our community is our foundation, supporting families, empowering local initiatives, and creating a place where everyone belongs. Be part of a legacy built on bold ideas and boundless possibilities. Join us in building a brighter future right here in Story County. Story County, helping build Nevada's future.
What is that?
That's the governor's funding bill for education.
It looks pretty flat. Wasn't there a plan to increase funding for our schools?
Yeah, but the governor's ignoring it.
We have to pass the plan.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Duy Nguyen. He's the Assembly member for District 8 in Las Vegas. So as I said earlier, you serve on Health and Human Services. Great concern at the beginning of the session about Medicaid funding could blow a huge hole in the budget. Senator Titus says that, no, we have the funds in the rainy day fund, et cetera, to be able to handle this. But what are your thoughts? Because we really don't have any feedback at this point from the federal government.
I wish I have a crystal ball on that as well, because, and for me, I'm not on the money committee, so I'm not aware of the conversation that is there. I think we have to be able to come up with a solution here, because what's going on in Washington, D.C. is confusing all of us, because all of a sudden priorities like Medicaid becoming not a priority. And I think that's something that's unfortunate that we are even experiencing, because these are the basic foundation of what we need in every day. Is if you're not healthy, you don't have anywhere.
Right, but we did have a big expansion during COVID. Is it time to perhaps pull back some of that?
Well, I think that's a difficult question to answer, because everybody's need is important, but we gotta prioritize healthcare before we prioritize anything else, because if you don't have health, you don't have anything. So that's a question that I'm not able to answer, because Health and Human Services is a policy committee. We're looking at all the options. We're looking at, do we have the basics covered? And that's what I talked about earlier in the program, is that we gotta look at the basic first before we get into the fancy things. So let's take care of the basics and make sure that we can balance the budget and take care of the basic needs of our citizen, and then we can go from there.
Okay, and it sounds to me like you're saying that potentially there are things that are presently covered by Medicaid that we could actually cut back on if they're not the priorities.
I don't think we're there yet. I think we've got to look at the whole picture, and I know Economic Forum is coming up very soon, so we're waiting for that number to give us a better answer, and I think all of us are waiting for the same things. So as we get there to the Economic Forum, we just got to be very, very cognizant of all the needs that is out there, and we want to be able to cover the basics.
And that's where we have to leave it. What a pleasure to meet you, sir. Thank you so much for doing this. Please come back.
Of course. Thank you for having me. Maybe later in the day.
Okay.
After caffeinated.
We'll be right back.
Your good times are at Tamarack Casino during the $150,000 Denim and Diamonds giveaways, with cash and free play drawings every Thursday and Saturday, and $30,000 in grand finale giveaways Saturday, May 31st, including a top prize of $20,000 guaranteed. Your good times are at Tamarack Casino.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to caanv.org.
Mom! It happens. And when it does, there's UMC Quick Care.
When in Carson City, Nevada Newsmakers records in the conference room of the Nevada Builders Alliance. Coverage of the 2025 legislative session is brought to you by Pro Group Management, workers' comp that works for you. NV Energy, proudly serving Nevada, providing electricity to 2.4 million electric customers. The Retail Association of Nevada, looking out for business. And by Story County, helping build Nevada's future.
Thanks for watching Nevada Newsmakers, come to you from Carson City, from the headquarters of the Nevada Builders Alliance. We'll see you on the next broadcast. Thanks for watching.